Hi, I'm Sal DiMercurio. I'm the founder and director of Cosmetic Plastic Surgery Center. Today's session will be about body lifts, specifically breast lifts and tummy tucks, otherwise known as abdominoplasty. The breast lift procedure is technically called a mastopexy. Masto is Latin for breast, pexy is lift or tightening. So the mastopexy procedure tightens and lifts the breast. If we're just lifting the breast of an inch or so, there's a minor procedure called a crescent mastopexy. That has to do with lifting the nipple, and the incision is right above the areolar, which is the brown portion of the nipple. And that's a very common lift for many women who have lost a bit of height but still are happy with their overall shape and size. For those of you that need a bit more tightening or a bit more lift, there's a donut mastopexy, which is an incision directly around the areolar, and the incision is a circle. The next level of mastopexy is the vertical mastopexy, which I call the lollipop incision. It encompasses a circle, but now has a vertical line straight down to the fold. And the standard mastopexy is one where you have a tightening of the entire envelope, and those are mostly someone who has lost a lot of weight or may have had a larger breast at one time, and now the envelope is larger, and an incision of the ones that I've mentioned would not be enough, and that would create anchor incision. The anchor incision is again a circle around the areolar and a line straight down to the inframammary fold, and then a line at the very base. And that's the most standard type of mastopexy. You choose a mastopexy only if you don't like the shape of your breast, but you're happy with the size. If you're happy with the size, then you don't need to change their size. Then reshaping the breast is usually done with a mastopexy procedure. If you want to change the size of your breast and the shape, then you really are looking at an augmentation procedure, and you should look at my session on breast augmentation. Let's talk a bit about abdominoplasties or tummy tucks. Much like the breast lift procedure, the tummy tuck procedure has a variety of different gradations, so to speak. There's the mini tummy tuck, which basically is a small incision, pretty much we call it a fan and steel incision, which is an incision like a C-section incision. The next extension to that would be a more standard abdominoplasty, where the incision is a little bit more lengthy and would extend out towards the hips. And then lastly, what we call the extended abdominoplasty for those who have lost either a lot of weight or have had multiple pregnancies or maybe have had twins. The abdominoplasty procedure does not just envelope the skin, but actually has a deeper component where the abdominal muscles are brought together. Picture, if you will, as you have a child, that the muscles that are sitting together like this start spreading apart. And the area in between the two muscles, which is called the linea alba, becomes stretched and weakened, and that gives you a contour that on profile looks like a small weakness or a pooch. That is repaired with the abdominoplasty procedure, either the mini. The mini is focused in mostly on the lower abdomen. If you find that you have laxity only in the lower abdomen, you might be able to get away with just a small mini abdominoplasty. If you have laxity both above and below the belly button, then you probably are looking at a more standard abdominoplasty. I hope this has helped, and I look forward to seeing you in consultation where we can tailor an operation just for you.